Good morning, everyone. It's Catherine Middlebrooks, the founder of BRB Yoga. How is everyone today? It is cold where I am, and I'm pretty south right now, so I can only imagine what those of you up north are feeling. Okay, so today I just wanted to come on and talk about what are you putting up with that you don't need to put up with in your postpartum body. This one is one that gets me fired up. So I'm going to go through a couple of common things that I hear about and that people talk about, and then talk about how those aren't things that you need to be dealing with. All right. The first issue, one that I hear way too much of, an issue that you may be dealing with that you don't need to, is leaking pee. Okay, this is one that really gets me fired up because as moms and in our culture, we have made a joke out of this. It's almost like a badge of honor of, oh, you had a baby, well, have fun on that trampoline, right? Like, we make a joke out of it. And it's not funny. It is not a funny issue. One, it can cause a lot of embarrassment. It makes you feel like your body is not working properly. And the last thing is that this is a sign that your body isn't working properly. It's a sign that your body is not handling the loads that you are putting onto it. And if you are having this issue now, it's a sign that your pelvic floor, stuff is going on in your pelvic floor that it's not working properly, and you want to address that because the people that are leaking today are going to be wearing Depends in 20 years. Right? And none of us want that. None of us want to be an incontinent older person. So, leaking pee is a very common postpartum issue, but it is not a normal issue. It is not something that you just need to take as a factor of, oh, well, I've had a baby, so now I'm going to be peeing myself. Common, not normal. Now, let me just say, all of this stuff, like if you just had a baby, this stuff can happen. This stuff will happen, and it is normal after you had a baby. I'm talking about if you had a baby a few months ago and you are having these symptoms, it is a sign that there are just some imbalances, some muscles that aren't working properly that you want to address because you don't have to live with this stuff forever. Okay, now a related issue is laxity in your vaginal walls. Susie just joined. Right, a good sentence. And you know what? This is the thing. We've got to talk about this stuff, right? If your tampons are falling out, hi, Susie, if you use like a menstrual cup and you can't hold it in, that's a sign that your muscular walls in your body are just weak and they need to be strengthened. So this is not something that you just have to deal with as a mom. There's a reason that countries like France provide all women who've had a baby with pelvic floor physiotherapy because those muscles need to be retrained. And once they're retrained, those issues go away. Okay, moving up the body to the core. Some things that you don't just need to deal with. This sense of noodliness in your core. When I first had my baby and I went back to work, I remember, I love vag talk. Me too. We should all be talking about it more. When I first went back to work, my boss, who I love dearly and is now my friend, so I can tell this story about her. But I was sitting at her desk at her table in her office, and I was like collapsed because I had a super weak core, right? My baby was like 4 months old, but I could not hold myself up, and she made a comment that I looked like Raggedy Ann. And I felt like Raggedy Ann. I could not hold my body upright for any length of time. Now again, if you just had a baby, that's normal. You don't have those muscles, it's going to be hard to hold yourself upright. If, however, it's a few months out or a few years out and you still feel like you're not able to sit upright or hold yourself upright for any length of time without feeling like you're going to collapse, that's not normal, and you don't need to put up with that. That's just a sign that your deep core muscles are weak and need to be strengthened. All right, continuing up. So another issue that's really common tight back muscles, right? So back muscles, especially the paraspinals that kind of line the spine. That and kind of back pain, ongoing back pain. For a lot of us, having a baby makes us feel like, oh, I'm like old and creaky, my back hurts, my back is tight, I feel like I need to stretch all the time. Common, not normal. The back is tight because the core is weak. It's doing the work that the core needs to be doing. So once you start retraining the core, then those back muscles can chill out a little bit and not have to grip so hard. And in the same way, a kind of just pain in the back is often a function of the fact that, again, the core strength, the core control is not there. And correcting the balance, right? In a postpartum body, the balance is off. The back is working really hard. The core is kind of shut off. If we bring that balance back, then often those symptoms will go away. So back pain, back tightness, not something that you need to just deal with as a mom. All right, and then the last one, I'm sure there are more, but this is all I thought of today. Tight neck and shoulders. Now this is one that you don't often think of as being related to the core. And to a certain extent, there is just going to be a level of tightness there because, especially if you're breastfeeding, there is just all this roundedness. However, for a lot of women, the tightness in the neck and shoulders is not just a function of the fact that you're living like this. It's a function of your breath being off. If your breath isn't working properly, which often happens in a postpartum body because when the baby was there, it squashed the diaphragm. The breath isn't working properly. Instead of breathing with the ribs and the diaphragm, we end up breathing with the neck and shoulders. So every breath you're taking is creating more tension and tightness up here. And often if we can get the breath working properly, it takes a lot of that pressure off of the upper body and it allows those muscles to loosen and not be so stressed. All right, so that's really all I've got today. Those are the things I thought of today. Again, I'm sure that there are lots of other things that we talk about as being part of being a mom that really are not part of being a mom. And I just want to encourage everyone, particularly, to stop joking about the peeing. Because it's not a joke. It's not a joke. It's a sign that something is not working right. And I get it, we have to laugh about it because if we don't laugh about it, we're going to cry about it. But rather than just laughing about it and moving on and taking it as part of the rest of your life, let's think about what we need to do to strengthen that pelvic floor, to get your alignment back into the right position so that that doesn't become a chronic issue for the rest of your life. All right, so let me know if you have any questions about any of that. And I'm going to throw a link below. I am running a live webinar on Saturday that will talk about 3 secrets to rebuilding your post-baby core. So if this is something that you want to learn more about, please, I would love to have you join. If you've been on other ones of my master classes, you probably don't need to sign up for this. It's a lot of the same information, but if you haven't ever joined one of my master classes, I would love to have you on and help you figure out what you need to do to not put up with all of these shoes. All right, everyone, have a wonderful rest of your day, and I will talk to you all very soon. Bye.